This video is for educational purposes only and does not replace official training, local protocols, or medical advice. Always follow your specific agency guidelines and medical control. Imagine your body is a giant, bustling city, and your blood vessels are the highways. The blood flowing through them delivers oxygen and energy to all your organs, like the brain, kidneys, and heart. Normally, your heart pumps at a steady pace, and the highways are the perfect width. But in an emergency, like when someone is in severe shock, the city loses power. The heart pumps too weakly, or the highways suddenly get way too wide. When that happens, the blood pressure drops, and vital organs don't get the oxygen they need to survive. That is where dopamine comes in. In emergency medicine, it acts like a superhero traffic controller. How it works: the dose dial. Dopamine is a special medicine given through an IV. What makes it super unique is that it changes its superpowers depending on how much the paramedics or critical care clinicians give. Think of it like turning a dial on a machine from low to medium to high. 1. Low dose, the kidney helper. At a very low dose, dopamine focuses entirely on the kidneys. It walks over to the blood vessels leading to the kidneys and gently stretches them wider. The result: more blood flows into the kidneys, helping them filter waste and make urine. It keeps the city's plumbing system running smoothly during a crisis. 2. Medium dose, the heart booster. If the medics turn the dial up to a medium dose, dopamine leaves the kidneys alone and jumps over to the heart. It wakes up special buttons on the heart muscle called beta-1 receptors. The result: it tells the heart to beat faster and squeeze much harder. Imagine a bicycle pump. This dose makes you pump faster and push with more muscle, sending a big wave of blood out to the body. 3. High dose, the highway squeezer. If the city is still in trouble, the medics turn the dial to a high dose. Now, dopamine targets the main highways, the blood vessels, throughout the body by pressing buttons called alpha-1 receptors. The result: it forces the wide, floppy blood vessels to squeeze tight and narrow. When you squeeze a garden hose, the water shoots out faster and harder, right? Tightening the blood vessels does the exact same thing. It forces the blood pressure back up so blood can reach the brain. When do paramedics use it? Because of these superpowers, emergency crews keep dopamine in the ambulance for a few specific life-saving situations. Severe shock: when someone's blood pressure drops so dangerously low that their organs are starving for oxygen. A dangerously slow heart: if someone's heart is beating too slowly, like 30 beats a minute instead of a normal 70, and other treatments aren't working, a medium dose of dopamine can force it to pick up the pace. It is a delicate balancing act, but when used just right, it keeps the city's lights on until the patient gets to the hospital.